What's going on, young people? Thanks for joining me for the last video of Unit 8 on clinical psychology. Remember, we only have 9 units in the entire school year. We are already finishing up Unit 8, so we are cruising. In our last video, we talked about like an introduction to treatment and therapy, talked about the history of treatment, the different professions. In this video, we're going to finish talking about treatment, okay? For my 2021 folks, y'all do not have school on Friday, March 12th, okay? It's a day off. And then next Tuesday, the 16th, is a digital learning day, okay? So B-Day folks, I won't see y'all for a while. What I'm asking y'all to do is to make sure that your test is done by 11:59 p.m. on Tuesday, the 16th, okay? So do what you gotta do to get that test done. Y'all did a great job with that last unit. Make sure you're reviewing, studying, getting ready, and doing great on that test. Today, we're gonna wrap up the unit in terms of notes by talking about the other forms of therapy. CBT, behavioral, biomedical, and some alternative therapies that folks can use. Let's start off by talking about CBT, cognitive behavioral therapy. Almost every disorder that I talked about this unit, when I talked about the treatment forms, it said CBT. CBT is probably the most popular form of therapy right now, okay? And CBT, cognitive behavioral, it's addressing your thinking, cognitions, which is tied to your emotions, which then impacts your behavior, your actions. Cognitive behavioral therapy. So there are two main people you need to know. The first one, his name is Albert Ellis. So if you will circle star that name, Albert Ellis, way back in the 1950s, he sort of came up with the first theory of CBT. He called it rational, using logic and thinking, rational emotive, having to do with your emotions, behavioral therapy. So REBT is what he called it. That was the sort of first form of cognitive behavioral therapy. And his whole idea is that humans are not logical. We are illogical. And therefore, we think negative things about the world, and that impacts us. We catastrophize. We exaggerate our problems because we have what he called, here's another phrase for you to circle or underline. He said, we have what we call irrational assumptions. These things that we think that we really shouldn't, okay? Let me give you an example. So here are some things. I'm gonna put up 6 irrational assumptions from Albert Ellis. A cool thing about his name, Albert, B-E-R-T. If you unscramble the letters in his name, boom, R-E-B-T. A little mnemonic for you, Albert Ellis. He said, some people think that you should be good at nearly everything. Some people feel that they need people to like them. Yo, these are irrational assumptions. You can't go through life expecting to be good at everything. You also shouldn't feel a need for people to like you. It doesn't matter what people think of you. That shouldn't impact you and your mental health, but it does. So if these are the irrational assumptions that you identify with, Albert Ellis said that you'll have feelings of anxiety, shame, and guilt as a result. 2 more irrational assumptions. Other people should always treat people fairly and kindly. People who treat me poorly, they should face consequences. Okay? This is for folks who have an irrational assumption about that the world is going to be a just and fair place. It would be nice if it was, but that's not the case, y'all. And if you go through life with these irrational assumptions that these things are going to happen, you will end up being angry, frustrated, and of course, we learned frustration leads to aggression, the frustration-aggression hypothesis, right? This is a bad outcome. The last 2 irrational assumptions that Albert Ellis proposed, it is awful when things are not how I want them to be. It's like when things don't go my way, it's the worst, and I don't have any control over my happiness and emotions. An external locus of control, as opposed to an internal locus of control with self-efficacy. If you go through life with these assumptions, you're going to end up feeling bad for yourself. You're going to end up procrastinating on things in your life. And Albert Ellis said that this is what is a sign of depression. Think to yourself, I'll ask you again in class, which of these 6 ideas is a thing that you have, one of your irrational assumptions? Which one do you fall into the most? Okay. So Albert Ellis said, he came up with called the ABC theory. He said that when a bad thing happens, we have beliefs about that bad thing and about ourselves. And then there are consequences in terms of our emotions and what we do next. So example here, I didn't get selected for the chorus group. That was just the action, the the adversity, the affecting event. Well, what do we believe? I have a terrible voice. I'm never going to be any good at singing. I'm a terrible person. I'm a failure. And then consequences, here's the outcome. We might get sad. We might stop singing, right? We might stop being friends with the people who did get selected. A, B, C. And according to Albert Ellis, this is bad, right? If you have an irrational belief when something bad happens, you end up having these unhealthy emotions and actions, right? What we need to do is when bad things happen, we need to be rational about those things. We need to have logic in our response so that we can have healthy, positive emotions. So ABC was Albert Ellis's idea. What cognitive behavioral therapy does is encourages us to dispute these irrational beliefs, meaning to challenge them, to point out the flaws in the logic so that we can have new effective beliefs. That's what REBT is all about, helping people change their thinking and therefore changing their behaviors. All right. So that was 1950s Albert Ellis. Next decade, 1960s, a guy named Aaron Beck came along and he sort of tweaked the system a little bit. He added in his own aspect to it. He just called it cognitive therapy, CT. So within the big category, CBT, we have REBT, Albert Ellis's theory, and we have ABC, Aaron Beck's form of cognitive therapy. And what Aaron Beck said was that the things we need to address specifically with depression is called the cognitive triad. The three things we think about: ourself, the future, and the world, right? Things being our fault, everything is going to be bad and it's going to last. I talked about this earlier in the unit with the stable versus temporary and the permanent and the global aspects of how people with depression, how they have an explanatory style that sort of creates a spiral or a cycle. Okay, so Aaron Beck focused on those things. Now, REBT versus CBT. You don't need to write this stuff down. I just want to talk for a second about the differences between these two approaches. Albert Ellis, he was all about logic, and he could be a little bit rude and abrasive, okay? He would just tell people the way you're thinking is stupid, it's dumb, it's irrational, change it. Whereas Aaron Beck, who came along later, said, no, there has to be a good personal relationship between the therapist and the client, okay? So while Albert Ellis would just be like direct and would confront his patients about their thinking, CBT is more about allowing the client to kind of work through their own misconceptions and kind of discover for themselves why their thinking is flawed, right? It kind of leans on Freudian psychoanalysis or the humanist client-centered therapy, right? Those talk therapy, the unconditional positive regard, the active listening to let the client figure things out for themselves. So Albert Ellis said that his methods depend on the personality of the client, whereas Aaron Beck focused more on, is it depression, is it anxiety, that the type of disorder is going to impact the way that we treat the patient, okay? We'll watch a video in class that kind of talks about REBT, but quick little check for understanding for you. See if you can answer these 5 questions. Make sure that you have the stuff in your notes and that you could answer this on a test or on the AP exam coming up. Cool. Second Roman numeral after cognitive therapy, CBT, let's talk about behavior therapy, also known as behavior modification, okay? Some people you need to know, Mary Cover-Jones. She is one of the first people, and she did an experiment where she took a little kid who was already afraid of something, and she used conditioning, those techniques of learning. Remember our unit on learning, the behaviorists, rewards and punishments, and classical conditioning and operant conditioning. She realized that you could use behaviorist principles to make someone unafraid. So Mary Cover-Jones and then Joseph Wolpe, they coined this phrase, systematic desensitization, meaning we need to have a process, a system for exposing people to their fears and anxieties so that they were no longer afraid of it. You may want to write the word exposure therapy off to the side. This has been found to be the best way to help someone who has a very specific anxiety. If they've been diagnosed with phobic disorder, meaning they have an irrational fear, we can use exposure therapy to slowly desensitize them. So like if you're afraid of spiders, don't look at the next slide for a second. If you're afraid of spiders, okay, ooh, scary. We can slowly have you go through these steps. You can look back now. People who are afraid of spiders, it's gone. Okay? What they have you do is make a list of all the things about spiders that scare you, kind of organize them based on how much they make you afraid. We teach you some techniques in terms of your breathing, maybe what's called biofeedback. We would let your body learn and pay attention to your brain waves and your thinking and your heartbeat and your breathing. And then slowly we would expose you to increasingly scary things about your fear until it doesn't make you afraid anymore, right? So we might start off by showing you a picture of a spider, having you hold the picture of the spider. We might bring out a fake rubber spider, put the rubber spider in someone else's hand. Let you hold the rubber spider, then bring out a real spider in a box, put the real spider in someone else's hand. What you can see here in this red graph is that when this new stimulus is brought out, heart rate spikes, the autonomic sympathetic nervous system goes into fight or flight response, cortisol, adrenaline, norepinephrine. Your fear response spikes, but over time you become what's called habituated, right? When you get used to an occasional stimulus, your brain will calm down and relax eventually. And like you can actually train someone who's been afraid of spiders to end up holding a spider without being too afraid. Pretty interesting. Other forms of therapy, alternative therapies, EMDR. I realize I missed a Roman numeral, so I paused. We're going back to Roman numeral 3, biomedical therapy, before we get to the alternative therapy. Sorry about that. Biomedical therapy, biological perspective, treating the body, right? So this might be chemical imbalances, maybe because of something genetic you inherited, or because of a problem with the physical structure of your brain and body. So I've kind of talked about a lot of these as we've gone through the various disorders. I want to have just one slide all in one place for you to study all the different types of drugs that can be used. So antidepressants targeting serotonin, so SSRIs or norepinephrine, SSNIs, some of the most common ones that they might reference, Zoloft, Prozac, Paxil, okay? These increase serotonin and norepinephrine. Anti-anxiety medications also target serotonin. So things like Valium or Xanax, you might have heard, right? They kind of help your brain focus, calm your brain and your neurons down. For these psychotic disorders like schizophrenia or bipolar disorder, or sometimes even someone who's on the autism spectrum, they might prescribe what are called the atypical antipsychotics. These are medications that impact your thinking, right? So they're targeting dopamine, right? The most effective one is known as Risperdal, but clozapine and thorazine have also been mentioned as prescriptions for schizophrenia in particular. But remember, these things that target your thinking, they can have negative effects on your body, tardive dyskinesia. The last thing we talked when we discussed bipolar disorder, the mood disorder, lithium, right? Like lithium batteries, 2 poles, bipolar disorder. So I want to have all the stuff in one spot for you, all the different drugs and medications that could be prescribed for the various disorders. Now let's get to Roman numeral 4 on alternative therapy. EMDR, I mentioned, helps with trauma, PTSD. It can also be helpful in some forms of depression as well, where they engage both sides of your brain with eye movements to help you reprocess memories and trauma and move on from those things. DBS came up a lot, as did TMS, right? Transcranial magnetic stimulation, where you are sort of trying to activate certain neurons to form healthier connections. Severe depression, sometimes pain, OCD, Parkinson's might use DBS or TMS with magnets. Electroconvulsive therapy is more extreme use of electricity. Last resort for, what does MDD stand for? It's a mood disorder, major depressive disorder, mania. So sometimes if bipolar disorder, lithium is not working or other medications. It's not normally used for schizophrenia. It used to be back in the day at time, but it's sort of like a last resort therapy. Another last resort therapy is literally cutting into your brain. So like when we talked about the patients who were having seizures, who would have their corpus callosum cut, splitting their brain in half. That's a form of what's called psychosurgery, right? Surgery on the brain. For folks who have severe personality disorders, right? The prefrontal cortex, which is in charge of your morals and your thinking and planning, if it's not working properly, at some points in history, they have, performed surgery, cut out a little chunk of the prefrontal cortex to try and see if it'll help it grow and work and form those neural connections properly, all right? In a lot of cases, with many disorders, seasonal affect, anxiety, obsessive compulsive disorder, as time goes on, sometimes people grow out of their symptoms, okay? Now, this does not mean that if you have a disorder, you just wait and hope it gets better, right? Treatment is important, therapy is important. You need to support people in your life who are getting treatment and therapy for mental disorders, but just be aware that sometimes things take time, right? If you're 18 years old, your brain has spent 18 years forming the neural connections and the patterns of illogical thinking or explanatory styles that it has. It's going to take some time to retrain your brain. So just be aware of that. Cool. Last check for understanding here about these other forms of therapy. Make sure you're getting ready for the test. Look over the notes. Let me know if you need anything. Appreciate you all. Peace out.